Good morning, Congressman Cecilia. Mr. Cicilline, can you?
On virtually is set up and everything. We can go ahead and start, if y'all are ready.
Fantastic. I'm going to read a few quick instructions and then turn it to you.
Okay.
In a moment, in accordance with House rules and regulations, the host will mute all participants other than Chairman Castro. All participants are asked to keep themselves muted when not actively engaging in the discussion. It would help limit echoes or other disruptions. In instances in which others are speaking but do not remember to remute themselves, the host will do so to limit any background audio. Members and witnesses are responsible for unmuting themselves anytime they wish to be heard. It may take a few seconds for your microphone to unmute, so please keep that in mind when speaking. A timekeeper will monitor the time for this hearing. If you're joining virtually, you can view the timer by switching your personal view in the upper right corner of your screen to grid view. If you're on a computer, you can also pin the timer by right-clicking or hovering your cursor over the timer icon and pressing the thumbtack. With that, we are ready to begin. Chairman Castro, if you could please count down from 5 so that the system displays your video, then please pause for 5 additional seconds while the recording begins, and then start the proceeding.
Thank you. 5, 4, 3, 2, 1. The Subcommittee on Oversight and Investigations will come to order. Today's subject is Consular Affairs and the COVID-19 crisis, assessing the State Department's response to the pandemic. Without objection, the Chair is authorized to declare a recess of the committee at any point, and all members will have 5 days to submit statements, extraneous material, and questions for the record, subject to the length limitation in the rules. To insert something into the record, please have your staff email the previously mentioned address or contact full committee staff. As a reminder to members, staff, and all others physically present in this room, per recent guidance from the House, the Office of the Attending Physician, masks must be worn at all times during today's proceedings, except when a member is speaking at a microphone. Please also sanitize your seating area. The Chair views these measures as a safety issue, and therefore an important matter of order and decorum for this proceeding. Please keep your video function on at all times, even when you're not recognized by the Chair. Members are responsible for muting and unmuting themselves, and please remember to mute yourself after you finish speaking. Consistent with House Resolution 965 and the accompanying regulations, staff will only mute members and witnesses as appropriate when they're not under recognition to eliminate background noise. Okay, the COVID-19 pandemic has upended our lives in ways that seemed unimaginable just a few months ago. We can all remember late March when the entire world seemed to be changing by the minute. Now, Americans across the country are faced with both a health and economic crisis that is far from over, and in many places in our country, only getting worse. Unprecedented is a word that probably gets overused, but it certainly applies to the situation at the U.S. Department of State. The U.S. Department of State faced many challenges during the pandemic. The U.S. government certainly has a long history of repatriating citizens, but never before had so many Americans in so many different countries and regions needed to be repatriated at the same time. The challenge was not simply arranging enough flights to get Americans home. Many Americans were located in rural areas, and internal lockdowns in those countries often made it very difficult to get people to the cities where flights were leaving from. There were numerous instances where people needed to take boats in order to reach buses that took them to cities to get on flights. Often the State Department had to negotiate each of these travel plans individually with host governments. The effort was not seamless, especially in its early days. I heard from many people who were stuck abroad and felt as though they weren't getting the support from the State Department that they needed. There were major technology issues with the STEP program. There were also larger issues, such as the announcement banning traveling to and from Europe, which caused a panic, resulting in overcrowded conditions in airports during a pandemic. Overall, though, the State Department's repatriation effort has been a success. State Department brought over 100,000 Americans home safely from 136 different countries and territories. This achievement is a testament to the hard work and dedication of our diplomats and civil servants who work tirelessly and often at great personal risk to themselves and their families. The State Department also did a good job of keeping Congress informed of the repatriation efforts, which allowed us to communicate with our constituents back home. And many of members of Congress, as you all know, to the witnesses, were receiving requests from constituents, often for their family members who were somewhere abroad. It's often difficult to convince folks of the value of the State Department. I think the repatriation campaign is a fantastic example of the tangible impact on how diplomats improve the lives of Americans. When faced with an unprecedented crisis, it was the U.S. State Department that got Americans home safely. Of course, we cannot simply rest on our laurels. One issue that will plague consular affairs for years to come is a lack of funding. Normally, the Bureau of Consular Affairs is funded entirely by fees collected for services like issuing passports and visas. Even in the best of times, money is tight because the Bureau can only charge what it costs to perform these consular services, and hundreds of millions of dollars must be transferred to the Treasury. And now travel has been nearly non-existent since late March and is likely to remain significantly reduced in the coming years. Today's hearing is an opportunity to discuss the Bureau's fiscal situation as well. There are also other challenges that we must address. One is that many Americans now owe thousands of dollars for the repatriation flights that the State Department arranged to get them home. With the economy in tatters because of the pandemic, many of these folks are unable to pay for these flights. Even as countries begin opening up tourism, travel restrictions against Americans remain in place in almost every country, including among our closest allies in Europe. I hope we can discuss what the State Department is doing to remove these travel restrictions. This is work that is urgent, as many Americans still remain in places other than their home, the United States, and they'd like to get here. And folks would like to be able to travel and see relatives in other nations as well that are right now not allowing Americans to travel. Finally, I think there's a danger that the Trump administration will attempt to use this pandemic as an excuse to advance its anti-immigrant agenda. We saw this with the attempt to deport many foreign students, a move that provoked so much outrage that the administration reversed itself. And this is unlikely to be the last attempt to use the pandemic for political purposes. While safety must remain paramount, not only at home, but also for our diplomats and public servants in embassies around the world, we cannot forego the openness that has made this country remarkable. This is true not only for moral reasons, but also because immigration and tourism help propel our economy, which is obviously in dire need. So, there's a lot of ground to cover and much to discuss, but before introducing our witnesses today from the State Department, I'd like to turn it over to our ranking member, Lee Zeldin of New York, for his opening comments.
Thank you, Chairman Castro, and thank you to our witnesses for being here today. During the early stages of the coronavirus pandemic, the State Department was faced with the ultimate challenge to protect and bring home American citizens abroad. As of June 2020, the State Department coordinated the repatriation of over 100,000 Americans on 1,140 flights from 136 countries and territories. They worked 24/7 to repatriate American citizens from around the globe, using every available resource from chartering flights to partnering with U.S. commercial airlines, to printing emergency passports to make sure every American citizen who wanted to come home could. With the help of the State Department, our office was able to bring many constituents home. Some of the stories are incredible. I'll briefly share with you two. A former Marine and his wife were taking a vacation in Peru when everything shut down. Under martial law, Peru's hotels shut down, leaving them stranded with no way out. The State Department worked with them, calling hotels to find space for them to sleep and make sure they were near the airport and ready to go the moment the plane arrived. Another one of my constituents was in the Canary Islands when the coronavirus pandemic hit. His mother was being hospitalized in an ICU with pancreatitis in the Canary Islands in Spain. Working with the State Department, we were able to secure a medical jet to transport his mother to the United States. I would like to take the opportunity to thank those at the State Department for stepping up to the plate during these unprecedented times. We would like to hear from our witnesses today on the lessons they learned in the earliest days of this global repatriation effort. Specifically, I'd like to hear about the challenges faced in countries like Peru, where there were a significant number of American travelers who struggled getting home. We want to ensure future repatriations can be carried out more smoothly. Over 10,000 Americans were repatriated from Peru, including constituents from my district, but the process was not easy. The Peruvian government was blocking the return of U.S. citizens until it received assurances that its own citizens could leave the U.S., essentially holding American citizens hostage. That is unacceptable and must be met with a forceful diplomatic response that the U.S. will not tolerate this kind of threat. As part of our oversight mandate, it is critical that this committee evaluate the strategies that were effective and look into possible ways to enhance states' abilities to repatriate American citizens in crisis. Additionally, the State Department has expressed concerns to this committee that it continues to see projected losses in fee revenues. Congress must ensure that agencies that rely on these revenues from visa and passport fees have the personnel to handle the backlog. I look forward to hearing from our witnesses on how Congress can help. I thank again the Chair for scheduling today's hearing, and I yield back.
Thank you, Ranking Member Zeldin. I'll now introduce our distinguished witnesses, and thank you all again for coming to testify. Our witnesses for today's hearing are Ian Brownlee, the Principal Deputy Assistant Secretary of State for Consular Affairs, and Karen King, the Deputy Assistant Secretary of State for Overseas Citizen Services. And I'll now recognize each witness for 5 minutes, and without objection, your prepared written statements will be made a part of the record. And I'll first call on Mr. Brownlee for his testimony.
Chairman Castro, Ranking Member Zeldin, members of the subcommittee, thank you for this opportunity to testify today. I'd like to thank all of your offices for your help and the support you gave us as we work together to repatriate those thousands of your constituents, our fellow Americans. This has truly been an all-of-government effort. We have coordinated with the CDC, DHS components, DOT, DOD, and the Congress to bring home over 110,000 U.S. citizens and lawful permanent residents worldwide. Throughout this outbreak, we provided first daily, then twice weekly briefings to both the House and the Senate to keep you updated on our progress in helping your constituents overseas. Thank you also for the additional appropriations and legislative authorities you provided in recent supplementals, supporting our ability to continue our work. Without that assistance, we would not be able to continue helping those U.S. citizens and lawful permanent residents overseas. To help manage the changing workload and to support our staff overseas, the Department of State established a repatriation task force, including subunits focused on congressional inquiries and cruise ships. At our posts overseas, officers who normally adjudicated visas shifted to American Citizen Services work, allowing the department to focus resources on our #1 priority overseas, providing assistance to U.S. citizens. Mr. Chairman, thank you for your recognition of the Foreign Service and civil servants, but I'd like to add to that my thanks to our locally employed staff and eligible family members who played a key role in exercising everything we did during the repatriation of these U.S. citizens. On March 20th, the Department temporarily suspended routine visa processing, and we began to significantly reduce passport operations. These dual actions were taken for the health and safety of both our employees and our customers. We project a more than 50% drop in visa fee revenue and a similarly dramatic decline in passport fee revenue due to COVID-19, with total projected losses of over $1.4 billion this fiscal year. We also foresee a continued strain on fee revenue throughout the next fiscal year. Thanks to the temporary expenditure authority provided in the CARES Act, we have used the carry-forward balances from certain fee revenue to maintain consular operations this fiscal year. However, we are on track to substantially deplete balances in those accounts by the end of this fiscal year. Most of the Department's consular funding comes from fees collected from visa applicants, and our current fee authorities allow us to use a portion of these fees to cover the costs of providing essential services to U.S. citizens abroad. CA's fee-for-service model relies on a stable flow of visa and passport applicants to fund those activities, and extraordinary activities such as large-scale repatriations. The pandemic has severely disrupted consular fee revenue. Our normal income is $3.5 billion annually. Relative to FY 2019, we expect a drop of more than $1.4 billion this year and a comparable loss in the next fiscal year. To continue offering emergency and routine services to U.S. citizens overseas, including overseas voting assistance this election year, we need additional authority such as that requested in the FY 2021 budget to better achieve full cost recovery and to maintain continuity of operations for these essential services until the anticipated recovery of demand currently projected for FY 2023. Specifically regarding U.S. citizen services, the administration's FY 2021 budget proposes allocating the cost of providing U.S. citizen services to security surcharges applied to certain visas. Thank you, Mr. Chairman, Mr. Zeldin. I look forward to answering your questions and those of the other members of the subcommittee. My colleague, Deputy Assistant Secretary Karen King, will speak more about our assistance to U.S. citizens.
Thank you, Mr. Brownlee. Ms. King. I think you need your microphone there. No worries.
Chairman Castro, Ranking Member Zeldin, thank you for the opportunity to testify today. I am proud to be here representing not only the Office of Overseas Citizen Services, OCS, here in Washington, but the consular officers and locally engaged staff worldwide who assist U.S. citizens every day under challenging circumstances. I assure you, you will not find a more dedicated team of public servants anywhere. Since the first news of the novel coronavirus outbreak in China, OCS has been at the center of an around-the-clock effort to inform U.S. travelers of the risks related to COVID and to bring home those caught overseas. The global consular team's work during the COVID outbreak is giving Congress and the American public an opportunity to see the broad range of actions OCS and consular officers in the field take every day to support U.S. citizens overseas. Although the COVID pandemic is unprecedented, we are not new to the business of repatriating citizens in need. We are not new to the business of communicating accurate, actionable, life-saving advice to citizens. Protecting health and safety of U.S. citizens abroad and helping them get home when they are in need has always been my office's core mission. Pete S. Brownlee described the extraordinary efforts the Department's task force undertook to expand our capacity to support our citizens overseas, and OCS is deeply grateful for the way in which the entire department mobilized during this crisis. OCS staff comprised the core task force staffing, and I pledge to you and the citizens we serve that OCS continues to monitor the provision of services to Americans worldwide and will continue to support repatriation efforts when and where needed. OCS officers are in constant touch with their colleagues at embassies and consulates overseas, and they provide policy and logistical crisis management guidance around the clock. More broadly, OCS maintains close contact with other State Department offices, as well as the interagency partners that comprise the COVID task force. We are fully prepared to flex as needed to support any renewed demand for repatriations, and we will call on the larger Bureau of Consular Affairs to bolster us as needed. OCS officers maintain the Consular Information Program that is the foundation of our efforts to protect U.S. citizens. Our products include travel advisories, country information pages, and timely alerts issued directly by our overseas posts. These products provide U.S. citizens with fact-based information designed to enable Americans overseas to make well-informed decisions regarding their safety. Our travel advisories in particular have also become invaluable to professionals in the travel, insurance, and private security sectors. The travel advisory system assigns each country an advice level ranging from 1, exercise normal precautions, to 4, do not travel, derived from metrics-based rubrics that assess crime, terrorism, kidnapping, hostage-taking, civil unrest, natural disaster, health, and other risks. The COVID pandemic poses unprecedented health and logistical risks for travelers, and we are working closely with experts at the U.S. Centers for Disease Control and Prevention, CDC, to ensure that our travel advisories take into account the latest data in each country. In tandem with CDC, OCS issued an unprecedented Level 4 Do Not Travel Global Travel Advisory in March. With conditions improving in some countries, we are following CDC's lead and returning to previous country-specific travel advice levels. As much as I hope we are never again confronted with a crisis requiring us to repatriate more than 100,000 U.S. citizens, we are ready to do so if needed. In fact, we are already working on how we would do it better. Rethinking and innovating in the face of challenges is critically important, and we are currently engaged in a lessons learned effort to identify action items that will enhance our responsiveness and effectiveness. I second PDAS Brownlee's request to work with you to ensure funding for OCS is not exclusively reliant on revenue sources outside of the department's control. The services we provide to U.S. citizens are just too important. Our office has the privilege of safeguarding the safety and security of U.S. citizens overseas. I'm proud to lead a team of foreign affairs professionals that serve our country and fellow citizens incredibly well. I reiterate my thanks to the chairman and ranking member for this opportunity to address you. I look forward to answering your questions.
Thank you, Ms. King. We appreciate your testimony very much. And I will now recognize members for 5 minutes each. And pursuant to House rules, all time yielded is for the purposes of questioning our witnesses. Because of the hybrid format of this meeting, I will recognize members by committee seniority, alternating between Democrats and Republicans. If you miss your turn, members, please let our staff know and we'll circle back to you. If you seek recognition, you must unmute your microphone and address the chair verbally. And I'll start now by recognizing myself. The Bureau of Consular Affairs is typically funded through the fees it collects for performing consular services. Obviously, the pandemic has drastically reduced demand for consular services. We understand, as you mentioned, that the department expects revenues to decline by $1.4, $1.5 billion in fiscal year 2020 and fiscal year 2021, with a continued decline expected in fiscal year 2022. This is an astonishing amount of money, given that in recent years, revenue has been about $4 billion. And so, as I mentioned, you described some of the fiscal situation, particularly Mr. Brownlee, but let me ask you, what actions is the Bureau taking to account for these dropping revenues, and what would be the impact of these falling revenues? In other words, what's the longer-term impact of this?
Thank you. Thank you very much for your question, sir. We are approaching this, as you correctly note, astonishing decline in revenue down essentially 2 paths. One is we are seeking to effect now, immediately, savings in our expenditures. And we have identified some, pardon me, make sure I get the number correct here. We have identified some $359 million in savings from the FY 2020 budget.
Do you have a sense of where those savings are coming from? A rough sense?
A very rough sense, sir. We have contracts, for example, we have contracts overseas where we have what we call greeters, assistants who move people through visa waiting rooms. Obviously, in times of greatly reduced visa demand, we don't need people moving through waiting rooms. There are similar sort of services. We're looking at a number of other projects as well, both domestically and overseas, where we can hold off on expending money or just not spend it all. But we're looking at a fairly significant reduction in this year's spending. We are also considering, we have used the money, thank you very much to the Congress for the authorities given to us in the CARES Act to go into prior unexpended balances that have been carried forward. So without getting into great detail, our fees bring in funds from a number of different sources: visa fees, passport fees, some surcharges. We had the broadest authority to spend what we call the MRV fee, the machine-readable visa fee. That was the one that was carrying us. With the systemic decline in visa demand that was taking place even before the COVID crisis hit, we were facing a problem, and we've been requesting authority to spend, for example, the passport security surcharge, to expend those funds to support our DAS King's operations overseas.
Well, can I interject just for a second? And I have one more question after this. I've got about 2 minutes left. But on this issue, let me ask you this. Are Americans going to have a different experience utilizing your services because of this? What is that going to look like? Is it going to take longer? What are you anticipating?
Thank you, sir, for the question. With regard to our services overseas, it is our key priority. We are not going to put Karen's operations out of business because of this. We are going to make sure that those operations continue unabated, consistent with what we can do safely, bringing the number of people into a waiting room, that sort of thing. So they may see some change in that respect. Health considerations may require us to restrict the number of people in a waiting room. With regard to domestic services, passport services, we have reinitiated the provision of the adjudication of passports. Beginning, I think it was on June 11th and early June, we declared our entire staff to be mission critical. That brought approximately 50% of the staff back into the office to do adjudications, and we have made significant, very significant progress in reducing the backlog that had developed in March, April, May, and early June. So,
Sure. No, well, thank you for that. And we've got about 40 seconds left. But let me ask you, some countries have started to not allow Americans to travel to their countries. Can y'all tell me how many nations are currently not allowing Americans to travel to their countries?
No, sir, I cannot tell you that off the top of my head, but we will get you that answer, sir.
Sure. Okay. Thank you. I'll turn over Ranking Member Zeldin.
Thank you, Mr. Chair. Congress informed the committee yesterday that of the $588 million of emergency money provided to the department in the CARES Act, $462 million has been notified for use, but only $104 million has been obligated. What are the plans for the remaining $126 million that has not been notified?
Thank you, Mr. Zeldin, for the question. I am going to have to take that, sir. I am aware of what we are doing in the Bureau of Consular Affairs. We are grateful for the support given to the Bureau of Consular Affairs in the CARES Act, but on the broader departmental question, we're going to have to get back to you, sir. Thank you.
Go ahead, Ms. King.
Yes, I would just say that in terms of monies to be used for U.S. citizen repatriations, we are using all the money we need for repatriation purposes.
Would either of you have any comments as to why only $104 million has been obligated so far?
I would say, again, where we have needed to use the funds specifically for repatriations and for evacuations, we have used that money. So to the degree we haven't used more of it, it is because we haven't yet had the need to do so.
Great, thank you. The state has said it is using the repatriation loans program account to help U.S. citizens pay for costs associated with commercial rescue flights operated by private air carriers. How much funding has the State Department obligated from the repatriation loans program account for this purpose?
I am going to have to get back to you with a specific number. I know that we have met our authorization, and so at this point we are using K funds for repatriation purposes, but I will have to get back to you with where we are with a specific number today.
With respect to individuals who lack the means to repay such loans, what actions, if any, does the State Department take?
The State Department works with the Department of Treasury, so when somebody is repatriated, there is a hold put on their passport until they have repaid the loan, and we work very closely with Treasury to get the loan repayment.
Any insight, though, to share if an individual lacks the ability to repay the loan?
The passport will remain held until they are able to repay the loan.
In January 2020, State announced the launch of the Center for Analytics to improve data management and analytic efforts to support diplomatic missions abroad. The head of the center, the first ever Chief Data Officer, Janice DiGiarmo, said she had developed a repatriation briefing book to support the repatriation task force. Would you be able to discuss the way this technology aided your efforts to track and analyze data repatriation requests and flight information?
Thank you, Mr. Zeldin, for your question. Yes, I found it very useful. As the head of the Repatriations Task Force, that became required reading for me, the Repatriations Briefing Book. Initially, it was coming out 3 times a day. As the efforts continued, the frequency decreased, but it was extraordinarily useful in seeing where trends were developing. What region of the world, for example, the Western Hemisphere remained a key focus for us. But as time went on, we saw, for example, there were more people trying to get out of Europe. We were intrigued to find there were relatively few people trying to come out of East Asia Pacific region. It was very, very helpful to us in deciding where to devote resources as we move forward.
Well, I thank you both. I think that the last answer kind of might have answered my last question, but I'll ask anyway in case you have any other insight on it. What work has the State Department's COVID-19 data analytics team done to evaluate changing conditions around the world to help ensure states' preparedness in responding to new localized outbreaks of COVID-19?
Thank you, sir, for the question. We are continuing to track conditions around the world, mainly through our ACS sections coming back to the Office of Overseas Citizen Services to ascertain where people, U.S. citizens, are expressing some degree of interest in returning to the United States. And it's important to recognize that some degree of interest phrase in there. We have relatively few people these days who are saying, I need to go now. We have people who say, well, if conditions change, if conditions worsen, what have you, I would like to go. So we are closely tracking that number. The Center for Data Analytics is helping us do that. And that allows us to determine whether we might need to lay on additional flights to this place or that place.
Thank you. And I just want to say thank you to both you, Mr. Brownlee, Ms. King, to your teams. There were a lot of challenges with regards to the pandemic, but your accessibility and the efforts around the world certainly were noticed, I believe, on both sides of the aisle here in Congress and by many of our constituents. I yield back.
Oh, absolutely. Thank you, Ranking Member. We'll go now to Mr. Malinowski, New Jersey.
Thank you, Mr. Chairman. Thank you to you both for being here with us, and just to reiterate Mr. Zeldin's point that that the department has been very responsive, very present when we've needed help with a particular constituent. That said, we need help, and there are some concerns I have about where we are right now in terms of providing services to people who need them. Let me just give you a couple of examples. I have a constituent, an American citizen, whose wife made a very difficult journey to Addis in Ethiopia in March for a visa appointment. It was understandably canceled in March. But it's a little bit harder for me to explain to that family why now in July we still cannot tell them when this American citizen's wife might get an expedited appointment. She has DHS per paperwork, everything in order. Another case, I have an American citizen child in my district whose Indian father was here on an H-1B visa, happened to go back to India in March because his father had passed away, went back for the funeral, and his appointment for his H-1B renewal was canceled, again, understandably in March, but a little bit less understandable, a little bit harder to explain to that child why in July we still can't tell him when his father might be able to get that appointment. So I guess my question is, why is it that at this point, especially with the resources we've given you, we cannot conduct expedited interviews in these relatively few cases where there's an American family that is broken up? Here we are meeting by video conferencing here. You certainly have that capacity technologically to conduct interviews. You have legal authority to waive the personal appearance requirement in cases where the national interest argues for it, or if there's an unusual or exigent circumstance. When can we expect progress in this area? To either of you who wants to take that.
Thank you, Mr. Malinowski, for your questions. I agree. The separation of families is heartrending. I'm pleased to say that I think it was last Wednesday, July 15th, we sent instructions to the field on how to resume routine visa operations. This will be largely dependent upon the condition, the diplomacy strong. And you understand when I say the phase of diplomacy strong in which a particular post is. For those posts that are in the later phases 2 and 3, it will be subject to essentially chief of mission. The Emergency Action Committee can decide that's where they are. The post may undertake routine visa services consistent with good health practices, safety, et cetera. The posts that are at phases 0 and 1 may come into the department to request permission to conduct certain sorts of visa applications, visa adjudications. So, for example, we're seeing requests coming in from some posts to begin doing student visa applications. So this is getting underway now. One of the difficulties we're finding is that this is not a static situation. I was briefing a DCM headed to a European post just yesterday. As our conversation began, we were discussing how his soon-to-be post was at phase 2. One of the staffers from the EUR Bureau broke in partway through the conversation and said, "I'm sorry, the post just asked to go back to phase 1." So,
but what about waiving the in-person requirement? You've done that apparently, I think, in some categories.
Yes, sir.
Like
we've done this with regard to certain workers, for example, the agricultural workers coming out of Mexico, the H-2As.
So why not students and scholars? Why not other categories?
I would be happy to take the question under advisement, sir, with regard to specifically with regard to those constituents. We are looking at everything we can do to get visa operations moving as quickly as possible.
Okay. I mean, let me just close with a final comment that I find almost painful to make, but we all first and foremost want to protect the safety of U.S. government employees. If I were a foreign service family with kids wanting to enroll them in school right now, I can think of a large number of countries where I would feel safer than the United States of America. If we were going to apply that phasing system to ourselves, we would not actually rank very highly. And I wonder whether we can do more to take that into account, as hard it is to acknowledge how poorly we are doing in response to this crisis domestically in making these sorts of determinations. And with that, I yield back. Thank you very much.
Thank you, Mr. Malinowski. All right. I'm going to ask a few questions because, as you can imagine, the bells rang for votes and folks are scrambling to go vote. And then we have 1 or 2 people who are interested in asking some questions. Hopefully that'll give them a chance to come back. If not, we'll probably recess for about 10 or 15 minutes and give them a chance to come back at that point. So I want to ask you, because we have been and still are affected by this pandemic, what safety protocols you're now taking in terms of when you deliver the services, when Americans take advantage of the services that you offer, what protocols have been put in place that offices are, putting up to ensure the safety of the officers, for example?
Thank you, Mr. Chairman, for the question. We're using protocols very similar to those you're using here, sir. We're keeping people at a safe remove one from another. We are only letting so many people into, for example, a visa waiting room. We have not yet begun expedited passport service where we have people being exposed at the physical counter yet. We are doing everything we can to begin moving our processes as quickly as possible, consistent with good conduct and safety.
And is there a mechanism for officers to communicate their concerns and to work through scheduling options that give them more confidence in performing their work?
Yes, sir, there is. I participate in, I think they're thrice weekly meetings with the Deputy Undersecretary for Management where we discuss what it will take to reopen various aspects of the State Department domestically. And so going back to Mr. Malinowski's observation, we obviously have the domestic diplomacy strong undertaking, and we are looking at individual regions around the country. National Capital Region, we have passport operations all over the country. As the conditions change in those areas, we decide whether we may more or less reopen there.
Okay. And given the backlog of visa applications that built up while embassies and consulates were closed, how will the State Department prioritize visa applications once offices are reopened?
Thank you, sir. What we are doing, as I said, we sent instructions to the field just 6 days ago now, telling them, as I said earlier to Mr. Malinowski, how they may go about reopening, depending on which phase of diplomacy strong they are now. For those posts, for example, New Zealand, that's fairly wide open, they may move.
Let me interrupt you for just a second because we lost our quorum because people have gone to vote. So we're going to recess here for just a bit, all right? The committee will come back to order. And I know that we were in the middle of the answer to one of my questions, but if you had anything further to add on as an answer to that question, and when you're done, I will turn it over to, let me see, David, actually, Ted and then David. I see David, so any final words on that answer, or were you?
I think I was substantially done. Thank you, sir.
Okay. Mr. Cicilline.
Thank you, Chairman Castro. And thank you to our witnesses for being here. During the peak, the first kind of surge of the coronavirus back in April, there were many governors that were pleading for more healthcare workers. And at the same time, the New York Times was reporting that foreign health workers had been lining up to take jobs at American hospitals, but had been prevented from doing so. And they described the roadblocks that included their inability to get visas, not being allowed to travel to the United States even if they had a visa, and in other cases, foreign health workers inside the country were not allowed to extend their visas. So my first question is, what is Consular Affairs doing to ensure that foreign health workers who are able and willing to help during this health emergency are able to get visas and travel to the United States or remain here in the United States?
Thank you very much for your question, sir. I can address what we are doing with regard to those foreign health workers who are overseas seeking visas to travel to the United States. With regard to those who are in the United States already seeking to extend their stay, I would have to refer you to the Department of Homeland Security, specifically U.S. Citizenship and Immigration Services, which is responsible for the extension of a period of stay in the United States. With regard to those who are overseas, right from the beginning, we have prioritized giving visa appointments, giving visa interviews to certain classes of people, including health workers coming to help us address the COVID-19 panic. There may have been some confusion in the initial weeks, but since then, the Assistant Secretary for Consular Affairs has made it clear and has in fact acted upon that clarity, that we need to make it possible for these health workers to come here, assuming they have the necessary work authorizations. Thank you, sir.
Thank you. And on July 6th, ICE announced that students taking only online classes would not be eligible for student visas. And then on July 14th, they rescinded this policy. And my question is, were any applicants denied student visas between July 6th and the 14th on the basis of ICE's announcement? And if so, will those applicants be given and notified of an opportunity to reapply?
Thank you very much for your question, sir. I do not know the answer specifically. I will have to get back to you on that one.
Okay, I'd appreciate that. Ms. King, as you know, countries around the world, including some of our most important allies, are beginning to allow people to travel to their countries again. And with very few exceptions, the United States has remained on a list of countries who are not welcome. A more cynical person might say that while President Trump has thankfully failed to build his wall along our border with Mexico, his horrendous response to the coronavirus has erected a different kind of wall, one that prevents Americans from leaving our own country. And what I'd like to know is what role the State Department is playing with our allies and other governments around the world to address the concerns so that Americans can travel again, and particularly have these governments provided specific metrics to the United States that will have to be met in order for Americans to be allowed to travel to their countries.
Thank you for the question. I know that many countries, especially in Europe, are looking epidemiologically at whether or not it is prudent for them to allow U.S. citizens in at this time. And I know that we are having very close conversations with governments throughout the world to see whether we can reach agreement on the comfort levels that they might have with allowing U.S. citizens in. I will tell you what my office is doing. We are working on our travel advisory to bring it down from the global level 4, which right now advises U.S. citizens against traveling anywhere in the world. We are working very closely with CDC, which is also looking at risk levels overseas for U.S. citizens so that we can provide accurate advice. And I'm hoping that in the near future, we will be at a point where there will be some countries where we can again advise U.S. citizens that although it may not be completely safe to travel, we will no longer be saying do not travel.
Yeah, no, I appreciate that. My question really relates to countries that are prohibiting U.S. citizens from traveling to those countries, not policy of the United States, policies of our allies. And to the extent that there are metrics that they are furnishing the United States that must be met before U.S. travel be permitted, it would be useful to know what those metrics are. I think it would help guide our response here in the United States. And so if we have specific metrics from allies or other countries saying you must meet these metrics before we will allow Americans to travel here, it would be very useful for Congress to know that and to see those metrics, and I'd ask you to make them available to us if they exist. And with that, I'll yield back.
Our regional bureaus are working very closely with governments, again, specifically the governments in European countries, to see what their basis is for deciding whether or not U.S. citizens may enter. And I know in Europe, in the Schengen countries particularly, they are looking at epidemiological markers very similar to what CDC is looking at in determining whether foreigners should be allowed into the United States. So if there's a desire for more details on what those markers are, I'm happy to talk to our regional bureau colleagues about the details.
No, thank you. And I do think that's an important question Mr. Cecilia asked, which is, we know now that there's a growing list of countries that have prohibited Americans from traveling there. And people have family members in these countries that they like to visit at some point, obviously. So it will be important for us to understand what it's going to take to allow Americans to get back to those places. So we'll follow up with you all on that. With that, I'll go to Mr. Liu of California.
Okay. Thank you, Mr. Chair, and thank you to the witnesses for your dedicated public service. We all really appreciate that. Two areas of inquiry. The first, I want to start out by thanking Secretary Brownlee and your great work with repatriation. I know that we had about 20 some constituents that need to be repatriated. We worked with your task force and they were all repatriated. And so thank you for that. My question related to that issue is, and I'm sorry if this has been asked before, I was told that some airlines, and perhaps U.S. airlines as well, were not particularly helpful in this effort. So I want to know if that was true, and if it was, what ways can we make sure that they're more helpful next time?
Thank you very much, Mr. Liu, and thank you for your kind words about the efforts of the task force. It was a remarkable effort, bringing together people from across the State Department, across the U.S. interagency, and frankly across the globe. So it is remarkable to have been involved in such an undertaking. With regard to the airlines, we found that as the confusion of the border closings took place, our Economic Bureau undertook conversations with U.S. legacy carriers and others to see whether they would be available to conduct flights into certain areas. In some cases, they were unable or unwilling to go into areas. In other cases, they were. So, for example, the legacy carrier, or the follow-on to the legacy carrier, Eastern Airlines, a small U.S. company, proved to be very, very helpful in going into areas in the Caribbean, Central America, and Northern South America. When we sought to bring people out of, for example, India, the question became more complex. And I don't think I would characterize the U.S. airlines as being uncooperative. It simply wasn't commercially viable for them to fly from the United States to India to pick up a load and then bring it back again. And this got them into the problems arose from such things as crew rest regulations, the need to fly 2 crews from, say, San Francisco to New Delhi. So in the end we ended up going with Air India, which didn't have those same crew rest issues. They could initiate their travel in India, pick up a plane load of people, bring them to the United States. So there was much confusion, but I don't think that I would characterize the airlines as uncooperative. Thank you, sir.
Helpful to know. I appreciate that. So the second subject I want to talk about is, what do we call this virus? So let me start by saying that what China did at the beginning in suppressing information about this virus is not defensible, and we should rightly criticize China for doing that. At the same time, this virus already has an official name, COVID-19. It has an unofficial name, coronavirus. And the CDC has said that we should not attach ethnic identifiers to this virus because it could lead to discrimination. And we already see across America that there have been approximately 1,900 hate crimes incidents against Asian Americans, including an Asian American family in Texas that was stabbed because the perpetrator thought they were spreading this virus. And I understand you can't control what the President of the United States says, but when the President or other administration officials use terms like Chinese virus or Kung flu, it does fuel hatred against Asian Americans, and it leads to hate crimes against Asian Americans. So I just want all of you to understand that words do matter. And when you stick ethnic identifiers in front of a virus that affects everyone, it can lead to very harmful effects against Americans who happen to be of Asian descent. And my question to you is there any official State Department policy on what you call this virus? And before you answer, I also want to say that, we don't call the swine flu the North American virus, even though it started in North America. The Spanish flu did not start in Spain. It likely started in Kansas. So there's no reason to call this the Chinese virus. If you want to say the virus came from China, I think that's fine. That's very different than how some other people use terms that can inflame people against Asian Americans. If you could answer my question about whether there's a policy on what you call this virus, that'd be great.
Within the Bureau of Consular Affairs, sir, we refer to the carrier of the virus as the novel coronavirus. The disease that novel coronavirus causes is called COVID-19. There is a pandemic generated by the widespread infection by COVID-19.
Thank you. I appreciate that. And I urge all federal agencies to do what you all do. And I hope the President of the United States understands he is president for not just some Americans, but all Americans, and that he understands his words can cause hatred towards a certain subset. And I wish you would just call this virus by its official name. With that, I yield back.
Thank you, Mr. Liu. Mr. Liu makes an important point as well, that the President's language has been incendiary in how he's described this virus. And attacks against Asian Americans, as y'all probably have seen, have skyrocketed during this pandemic in no short measure because of how the President has described this virus, and others as well. With that, I'm going to go over to Debbie Dingell, but first I need to read just a few lines. I ask unanimous consent for Representative Debbie Dingell of Michigan to participate in this hearing and ask questions after all subcommittee and committee members have done so. Hearing no objection, I'll go to Debbie Dingell of Michigan.
Thank you, Chairman Castro, and to Ranking Member Zeldin for convening this important hearing to discuss the COVID pandemic and its impact on the State Department's consular programs. As today's witnesses have outlined, COVID-19 pandemic has resulted in the evacuation of 100,000 Americans on over 1,000 flights from 136 countries and territories. And quite frankly, a number of them have been from my district. However, these evacuations can come at a substantial cost for Americans abroad, as they are required to pay the equivalent of a ticket on a commercial flight from the area in which they are evacuated. Additionally, the State Department will put a hold on the individual's passport until the amount is repaid. This resulting cost is often very surprising to individuals at the amount of it and burdensome, and several of my constituents discovered when being evacuated from the Caribbean in 2017, so this is before COVID, they had to pay hundreds and thousands of dollars in reparations loans each. That's why Congressman Jim McGovern and I have introduced the Leave No Americans Behind Act, which would end the State Department's practice of charging these fees. Mr. Brownlee, I'd like to ask you some questions. Can you provide details on the total costs of the repatriation efforts? Specifically, how much did the entire campaign cost the State Department? What were the costs of the flights?
I'm sorry, pardon me. Thank you, Ms. Dingell, for your questions. I have here in front of me information that indicates that in repatriating the over 110,000 people, the department spent over $195 million, specifically over $196 million. I have a breakdown beyond that if you're interested, but that it's a total of $196 million. How we arrived at the individual costs of a particular flight, that is governed by law and regulation. We are required by law to take a promissory note from anybody for whom we put onto one of these K-Fund chartered flights. The amount of that promissory note is fixed by the Bureau of Administration within the State Department, and essentially what it comes down to is what one would have paid for a ticket if one had showed up at the airport in, say, Santo Domingo looking for a flight to the United States the day before the crisis hit. So the immediate pre-crisis price. As the effort to repatriate people continued, we expanded our lift capacity by bringing in commercial carriers as well. In some cases, they were able to do this for less than what we would have charged. In other cases, they found they could only make money by charging more than we would have charged for a corresponding flight. In any case, we left nobody behind for reasons of money. Either people could come back using the promissory note on one of the K-Fund chartered flights, or the American Citizen Services section in the country in question could issue the person a repatriation loan. And we issued a very significant number of repatriation loans, or have issued a very significant number of repatriation loans during this crisis. As of I'm sorry, I don't have the exact date, but we hit our congressionally mandated cap on the repatriation loan program of about $5.6 million about a month or two ago, and since then we have issued, I think, some $2 million approximately in repatriation loans coming out of the K-Fund. I hope this answers your questions, ma'am.
I have a lot more questions. I appreciate the information. I'm going to have to be fast because I'm down to 45 seconds. But you know that a number of individuals are unemployed. They're now having very real financial situations. How do we help them in repaying these notes? And many other countries who assisted in the repatriation of their citizens didn't charge their citizens or their family members to return home. So in the State Department's assessment of actions you've taken during this time, are you looking at charging citizens in an emergency something under consideration to change, or how you help people in these dire times?
And y'all can give a full answer on that. We're waiting for, there may be one more member that's got questions. So go ahead, and if Debbie, you have another question, go ahead too.
Well, let's get the answer to that one.
The requirement to obtain reimbursement from U.S. citizens pursuant to issuing a repatriation loan is a matter of statute. So the U.S., the Department of State does not have a choice in that matter. Again, our goal in consular affairs is to make sure people get out of harm's way absolutely as quickly as possible, and that in some cases does require the repatriation loan program. But we are not in a position to forgive those loans, given the statute.
So that's why we need the Leave No American Behind law that Jim and I have introduced. So individuals who boarded the State Department chartered flights had to sign promissory notes promising to pay the State Department back, and some of them are now finding they don't have their passports. Not that anybody really should be traveling right now, but they need it for other reasons, and they're hitting credit issues, etc. How much in dollar value right now do you think's out there in promissory notes?
Ma'am, thank you for the question. We understand that some $7.5 to $8 million in repatriation loans are outstanding. In terms of promissory notes, we're going to have to get you that. We're going to have to get you that information, ma'am.
Thank you, and I do thank you all. I've had a lot of desperate people, and you've got multiple times more that in the last few months. These are tough jobs, and we want to make sure our Americans are safe and brought home safely. And we probably don't say thank you enough to people who are trying to help our fellow Americans.
All right, thank you.
Mr. Chair.
Thank you, Representative Dingell. And we've got one more member who's going to be coming. Of course, again, remember, people are voting and coming back and forth. And so it'll take about 5 minutes. Ted, do you have any other questions you wanted to ask? I'll just check with the members that are here. If not, we can recess for 5 minutes, but just want to make sure there aren't any other questions that folks wanted to ask. Yeah.
I'm good, Mr.
Okay. All right. We'll recess for about 5 minutes. I promise in about 20 minutes you'll be out of here. All right? Committee's in recess. All right, the committee will come to order. And now recognize Ms. Omar.
Thank you, Chairman. Thank you so much for being here with us, Mr. Brownlee. My office heard from several people who had approved visas and were unable to travel due to the COVID pandemic. We also heard from people who were in the middle of an approval process and those whose time limits expired during the pandemic. It doesn't seem fair to me that people might lose their visas or have to pay additional fees through no fault of their own. Will the State Department automatically extend people's deadlines or visas to accommodate them when those things expired through no fault of their own? And can you guarantee that they won't be able to pay additional fees for their cases?
Ms. Omar, thanks very much for that question. This is an important issue. We understand that we were required back in March to close down visa operations. I'm very pleased to say that beginning 6 days ago, we sent instructions to the field on how they could begin, the individual posts around the world could begin resuming routine visa operations. We recognize that a great many people had paid for visa appointments, and those visa appointments were canceled. We recognize that a great many people had done their, for example, panel physician examinations. Those the results of those examinations will have expired. We are formulating guidance to the field right now on how to deal with these various issues. We are very cognizant of the fairness issue here, that people paid in good faith for certain services and did not receive them. We also recognize that there were time limitations on various other documents that were not always within the control of the State Department. So, for example, some would be petitions that had been approved by U.S. Citizenship and Immigration Services. We're looking at this closely right now, and I hope to be able to give you a more fulsome answer in the near future.
Wonderful. We'll follow up. Thank you so much. I know how anxiety-inducing it is for people who've waited for a long time to have gotten the opportunity and lose it. So thank you. Ms. King, I just wanted to talk a little bit about repatriation. First of all, we all recognize how incredibly difficult and unprecedented this repatriation effort was, and I'm amazed by the hard work and passion of the embassy staff and career officials. I know it wasn't easy, and I know there will be a lot of lessons learned to prepare us for a truly global event like this one in the future. How would you characterize the differences between the different countries in terms of our communication with those countries doing this effort? And are there countries where we didn't have adequate notice of their own plans to close airports and restrict flights?
Thank you very much. Thank you for your kind words for my team, first of all, very much appreciated. In terms of the repatriations, I think one of the main problems that we did encounter was lack of advance notice from a number of countries. I certainly feel that if we were to do something differently in the future, we would have all of our embassies reach out immediately to the host governments to find out what their intentions were in terms of closing borders. We were very much focused on where the epidemic was threatening U.S. citizen lives overseas, which was obviously China in the beginning and then moving into Europe. Obviously, where we saw a lot of issues with Americans unable to come home was in Latin America, where a number of countries, for example, Peru, did shut down the border with very little notice, and then we were in a position of having to request exceptions to bring in our rescue flights and our K-Fund flights. We saw a similar phenomenon in Morocco. There we were very successfully able to get them to delay closure of their airport while we were able to get in rescue flights. So I don't think that there was any one specific country. I think throughout the world we saw this phenomenon.
I think one of my concerns involved cases in Venezuela, and in this case, it looked like we were letting politics get in the way of doing our duty to protect U.S. citizens. And I know oftentimes, we have to prioritize the safety of our citizens and our ability to reunite them with their families here at home. So I hope in the future, as we learn from this, that we work to try to create that priority and substitute our ideology and politics for the reality of what it means to have our citizens back home. Thank you, and I yield back.
Thank you, Ms. Omar, and that concludes the member questioning. Again, I want to thank our witnesses from the State Department for your testimony. And Ms. King, I think you made an important point at the end here in your last answer where you talked about some things that we might have done differently or approached differently next time. I think all of us do not hope for anything like this pandemic or anything close to it in the near future or really ever. However, it is important that at some point we take stock of lessons learned and what we could do better, what we should do differently next time. And I hope that the State Department will work internally to put that kind of document together, but then at the right time also share it with Congress. With that, I want to say thank you, and this meeting is adjourned.